My name is Ramesh Rengan. I'm Medical Director of the SCCA Proton Therapy Center. In order to develop and craft a therapeutic plan for cancer, you need to know not only about the disease, but you need to know about the individual. The fundamental property of X-rays is that they go in one side and they come out the other. That rule changes with protons. The best and most successful approach is to minimize the amount of normal tissue that is exposed to the cancer treatment that we're delivering. And with radiation, the pinnacle of that evolution is proton beam radiation. So with protons, we have the ability to deliver a therapy that enters, but it doesn't exit. It stops where we want it to stop. That offers two significant benefits to the patient. One is if I have a tumor that's sitting right next to something I want to protect, I can dial up a proton beam that'll stop within the tumor. Second of all, the beam, as it goes through the patient's tissue to get to the tumor, doesn't do as much damage because most of the damage that the proton beam does is really at the end, just before it stops. So if I can choose my proton beam such that I want it to stop within the tumor, then I've solved a significant number of the physical challenges that we are faced with when it comes to treating a patient with X-rays. And that's the reason why everybody is so excited about proton beam radiation. It offers the promise of delivering effective therapy while minimizing side effects, specifically by eliminating the amount of normal tissue that gets exposed to our treatment. So where could that yield a benefit? Well, it varies depending on the patient population you're looking at. If you're thinking about pediatric patients, one of the big concerns that we have is that radiation exposure of healthy tissue to radiation can leave them at risk for developing another cancer further down the line. Maybe not 5 years down the line, but a decade, 2 decades down the line. So the case there for proton beam radiation is we minimize the risk of second malignancy in these pediatric patients. There are some cancers, such as lung cancers, tumors that are sitting near the spinal cord, and proton beam radiation can be a real boon to those patients just because of the precision with which we're able to deliver our therapy. And the way we benchmark our success is we want this treatment to not only cure the patient of their disease, but provide them with a significant improvement in their long-term health and their long-term quality of life going forward. As an oncologist, it is a privilege to be entrusted with the care of a patient who's faced with such a difficult obstacle in their lives. It's inspirational. I learn from every patient, and I'm inspired by every patient I have the privilege of meeting. I am tremendously proud of every single individual who works here. They are mindful of the fact that they are helping and participating in the patient care mission. They go out of their way to go the extra mile to make this journey, which is a difficult journey, as comfortable as is humanly possible. And I think all of this makes the experience a far more positive one for our patients. This is something that the future is always there for every single patient who walks through our door. We're going to find more and more patients who are going to benefit to a greater extent from the proton beam radiation. The SCCA Proton Therapy Center, we strive to provide the very best of care not only for our patients, but their families.